And now it's going, okay, how then do I apply this in my everyday movement? So those who have taken the group sessions or watched some of my videos, what we're going to start to realize, and we need to start to comprehend for ourselves, is that our joints are communicating, our limbs are communicating everything that it needs. So my point in that is if you look at the ankle joint, the ankle is supposed to do this, just like the wrist, as above, so below. My toes, my fingers are supposed to do this. If you then go up through the knee is just going a hinge. The elbow will do the same thing. It has a little bit of this little motion here, but it's really the bones here. It's a stabilizer. The wrist is a mobilizer. The elbow becomes that stabilizer. Now, as you go up into the shoulder, you have another mobile joint. What we're experiencing for a lot of people in regards to arthritis becomes stabilizer muscles taking on a brute force that the wrist and the shoulder need to be doing in regards to its free flowing 3D motion in relationship to one another. So ultimately, if this can't move through its range, it's got to go somewhere. The force that's being created has to go somewhere. And most people, it becomes the elbow or that knee. Now, I know people have arthritis in the fingers. I know there's arthritis in the backs. Just know that that communication is saying, I need you to do something that you're not doing. And that is creating motion with intention. When we're living our life here in minimal motion, obviously those who we're working the pivot points. If we're not getting that flow, as Tom was bringing up, we're not creating blood flow. We're not creating that tension. There's a lack of flow, not just blood, but the release of that lymphatic or that interstitial fluid in order to detox that body naturally.